So let's go straight into tonight's discussion. Right. Let's go straight into tonight's discussion. So tonight we are talking about prolactin, and as usual, we'll tell you all the story in details. So you want to grab your pen, your paper, right? And if you cannot write, don't worry. The videos will be on YouTube. So you want to go to YouTube, search my name, Dr. Godwin EMB. All the videos, everything concerning fertility is there. So you watch those videos, and I guarantee you, if you watch them long and hard enough, you will be pregnant. And for those who are trying to conceive, I have a preconception blueprint, a practical guide on what you should do, how you should do it, and when you should do it, with checklists for every week that can help you with your conception journey or fertility journey. So this is the book, the preconception blueprint, a practical guide to preparing your body, your mind, and your life for pregnancy. So go to my bio now, tap on it, the digital store will open up, tap on the book, download it, and start practicing your way to pregnancy. Right? Is that Paige? I thought I saw Paige. Hello, Paige. You're welcome. So let's begin. This is fertility. Oh boy, I'm thinking about you. Doctor, your tube is blocked. Really? Okay, we'll talk about it when I'm done. Right? So I'm thinking about you. What you would do with the quality information we are sharing with you. It will not only cut the costs of your journey, it will save you emotional stress, physical stress, and it will save you a lot of time. Right? Because a lot of people are wasting their time, not because there is some real fertility concern, it's just because of ignorance. Right? So we are trying to demystify fertility, and I'm sure you are following. If you are not following, I cannot help you beyond this. Right? If you come to my DM, you pay. You hope you know that to say hi in my DM, you have to pay. Right? But I'm here for you in the live stream to tell you everything you need to know. Everything you need to know. The questions that have answers, we will answer. The question that does not have answer, we'll leave it to God. Why? Because He has all the answers. Is that okay? All right. So let's begin our discussion. Tonight we're looking at that hidden hormone that can quietly shut down your ovulation. And that is prolactin. Right? Every journey begins with hope. That hidden hormone that can quietly shut down ovulation. Every heartbeat tells a story. That's what we're talking about tonight. This is fertility. That is your best track. There is a pattern that confuses a lot of people in fertility, right? And the pattern is cycle may be irregular or sometimes even present, right? Hormone looks mostly okay. Ovulation is inconsistent or missing. Then one test comes back slightly elevated when you do your hormonal profile, and you hear something like your prolactin is high. Don't be juju be that. The prolactin is high, and that may not sound serious. It's like, hey, Ivy, oh my God, that is Ivy. Ivy is here. Hello, Ivy. Good to see you. You're welcome. This is fertility. Right. Now, that may not sound serious at first when they say, oh, madam, you have high prolactin, right? It may not sound serious at first. After all, prolactin is known as a hormone for breastfeeding, right? It's a breastfeeding hormone, right? So why should it be serious if it's high? So what does it have to do with fertility? Is that not something you the other kind of question you want to ask, right? A lot more people than most people realize something about this prolactin, and that is why I'm going to take my time, slow, steady, but explicitly explain prolactin and how problem can arise vis-a-vis how to correct it. If you are ready for this discussion tonight, please tap on your screen, share the live, follow me, talk to me in the comment section, just type ready, then we'll begin with the first part of the gist. First, I need to tell you what prolactin is. What is prolactin? So tell me in the comment section, just type ready. I know you are ready for the discussion. I'm waiting for your ready. Who is ready for tonight? Oh boy, I know you are ready. All right. So the first part of the gist is to first explain to us what prolactin is, right? Because we cannot talk about something we don't know anything about, right? So what is prolactin? Prolactin is a hormone that is produced by a part of your brain that is called the pituitary gland, right? We've talked about pituitary, but don't worry about the name. Just know that there's some part in your brain that produces prolactin. And the primary role of this prolactin is to support milk production, right? After birth, the milk production that baby need to suck milk, right? So that is the role of this prolactin. That's the primary role. So during breastfeeding, the prolactin levels will rise. Right? Why? Because more breast milk need to be produced. And because prolactin levels are rising, naturally, that prolactin suppresses ovulation. So the prolactin level that is rising is a natural birth control, right? It's a natural birth control. So that's why we tell women, breastfeed. You say no. You refuse to breastfeed. Now, you don't carry another belly picking at 2 months, right? Right. Breastfeeding is the contraception on its own. Why? Because as your baby is breastfeeding, it is stimulating for milk. That means more prolactin will produce. The more prolactin is produced, the more it's suppressing ovulation. Simple biology. Once you understand it like this, you have solved half of your birth control problems. Right? So, this suppression of ovulation is not a problem. It's just biological design. Because even biology knows that you are not supposed to be conceiving while you are still breastfeeding. Remember those days how some of us, I don't know about you, I think Gen Z children, they don't enjoy nothing. We suck breast up until we're 2 years old, right? You know how it's done those days. A child will just come, the child will be sucking breast. Then you remember that it's supposed to go and play ball. You run to go and play ball. After playing ball, you run back to the mother's breast. Right? That's how we used to do it. And for that 2 years of continuous breastfeeding, the woman will not conceive. This is people in the village who does not know nothing. Every journey begins with hope. So you see what biology is doing. Tells a story. I think we are messing with biology. That's why people are having a lot of problems. Right? This is life. So the body is essentially saying you should focus on nurturing the current baby before starting another pregnancy. Full stop. If you would breastfeed. But I don't know what this Gen Z thing is happening. Like, forgive me, I don't know. If you understood anything I just said, please talk to me in the comment section. Well, it's your choice to breastfeed for 2 years if you wish. That will not concern me. They say, oh, 6 months. Oh, 1 year. Really? Me, I sucked breast for 2 years, and I was playing ball from ball to breast, breast to ball, ball to breast. See why I get sense. See why I know book, right? Oh boy. So, well, whichever way you want it. You want 6 months, God bless you. But don't ask me why you're now pregnant. And now you're choking yourself with all manner of contraception. Tells a story. I'm tired of this people. Breastfeed and not quitting no good. But then will come again. You go fear now. Right? Everything that man has done is to antagonize natural cause. Now we are advising you 6 months is okay, 1 year is okay, this year is that okay. Good. Every heartbeat tells a story. If you can reason, they didn't have to do all those things. This is life. But yet, the closest we are in age, we're 2 years difference. But today we do all those things, and children are just 9 months difference, and you're putting all manner of things to block pregnancy. Really? That is the biology. And whether you like it or not, nature has made provision for spacing. The problem is you are not doing it correctly. This is fertility. Okay? Alright, let's go to the next thing. I hope that part is understood. I hope. If there's anybody listening at all, I hope that part is understood. Now, the problem begins when prolactin is high outside pregnancy, and that's the part of the gist that I'm interested in. Right? When prolactin is now high, you are not pregnant. You are not breastfeeding. Prolactin is high. That is the problem I'm interested in. Because when prolactin is elevated in someone that is trying to conceive, the body is receiving the wrong signal. The body is receiving the wrong signal. Right? Even if you are not pregnant or breastfeeding, the system will behave as if you are. So where is this prolactin coming from? The message goes to the brain to say, hey, I'm breastfeeding. But you are not pregnant. You're trying to conceive. Prolactin just went up, and the brain thinks that you are breastfeeding, and it shut down ovulation. And now you've been trying for many years. Why? How did we get here? Right? Why? Because you're not pregnant. Prolactin is going up. It's going to suppress or disrupt ovulation. Every journey begins with hope. Right? Christy Labelle said, which day the brain go understand say we need belle self. No, it's not that the brain does not know what to do. Lifestyle and environment is confusing the brain. That's the reason for all this infertility concern we have around the world. The brain of the population is confused. Should we be pregnant? Should we not be pregnant? Eventually, you go to the clinic, they force your brain to respond. Anyway, let's understand the biology first. See where the problem is, then how to correct it. Is that okay? But I want to tell you quickly how prolactin blocks ovulation. Who's ready for that gist? How prolactin blocks ovulation. Right? Let's, as usual, open the system clearly. This is not rocket science. You don't even need to go to school before you understand this. Right? So like I said yesterday, the reason for making these things difficult is to differentiate between those who went to school and those who did not go to school. It's just to understand the principles. Right, let's open the system and see clearly what's going on. Now understand that ovulation depends on a chain of signals. Yeah, if you have been following, you already know what I'm talking about. There's a part of the brain, the hypothalamus, that communicates with another part of the brain, the pituitary gland, that will release hormone that will instruct the ovaries to begin to produce, or rather mature eggs, that eventually ovulation takes place and you're ready for pregnancy and stuff. So that's just the simple biology and communication between your brain and your ovary, right? This system I just mentioned, the hypothalamus, the pituitary gland, and the ovary, that communication should work effectively. Yesterday I told you about the rhythm. So prolactin interferes with that rhythm at the top. That's what prolactin does. Prolactin interferes with the rhythm. And once the rhythm is interfered with, confusion sets in. So when prolactin is high, when prolactin is high, it suppresses the first messenger, right? I don't want to bother with the big names. It suppresses the first messenger, the GnRH, that is the message that is coming from the hypothalamus, the very first place of the brain, right? It disrupts it, because normally that one comes in rhythm, like pish, 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 pish. That is rhythm. So when prolactin goes high, it disrupts that rhythm. You may have so it's confused. So if that rhythm is disrupted, it means that instruction that goes to the ovary also will be disrupted. This will reduce the FSH and LH release. Now it's confused. And if FSH and LH is affected, the follicles will not mature properly. They won't. Ovulation will fail or becomes irregular. So that's basically what happens. So if you are, even if the ovaries are capable, nothing is wrong with the ovaries. Even if they are capable, they will not be receiving the correct instruction from the brain, because prolactin has gone to disrupt the message. That, in other words, what prolactin does is to kill the messenger, right? Right? Do you understand anything up until this point? Please talk to me in the comment section. Talk to me in the comment section if you understood anything up until this point. Every journey begins with hope. Yeah. Every heartbeat tells a story. If you understood anything, talk to me in the comment section. One day, you will look for this information. Even with your money, you will not see it. So enjoy it now. The next thing we want to talk about is thank you for the heart, Mary J. Mary J is here. Mary J, thank you. Every heartbeat tells a story. Right. This is fertility. Now, when there is disruption, because when prolactin goes up, that message is disrupted. So when that disruption happens, these are the things you notice. Right? When prolactin is high, it does not always announce itself. Is there somebody with hyperprolactinemia that say, "Oh, I have hyper"? How would you know if you didn't go to test? Right? So it does not announce itself. Every heartbeat tells a story. Right? But these are the possible signs. The possible signs that will be noticed. One, you got irregular or absent periods. Take note. Possible signs of prolactin issues. Irregular or absent periods. 2, delayed ovulation. 3, unexplained infertility. You've done everything. You've tested, you checked your tube, even sperm quality is good, but pregnancy is still not coming. Prolactin is one of the possible causes. Then, in some cases, you have a milk discharge, milky discharge, not milky discharge from the breast. And in some cases, sometimes you don't even have any obvious symptom at all, but the problem is there. Right? But the problem is there. So the question is, how high is too high with respect to prolactin? How high is too high? This is where many people get confused. Right? Prolactin does not have a simple good or bad cutoff point where you say, "Oh, this is the cutoff point," because mild elevation can already affect ovulation. Just mild increase because ovulation issues. And of course, you already know that as the levels go up, there is a likelihood of suppression of ovulation. Right? Interestingly, the levels of prolactin can fluctuate. As funny as the prolactin issue is, it fluctuates. And what are the reasons why it can fluctuate? It can fluctuate due to stress. It can fluctuate due to sleep pattern. It can fluctuate due to time of the day. Simple biology. But the issues that can arise is from simple things. That's why I tell you, if you understand the information, you're likely paying nothing to correct it. But people have been suffering for many years. Some say, I'm tired, I've spent so much. You will spend so much. You will spend so much. Thank you very much for the handout. You will spend so much because of lack of knowledge. One time I was consulting with somebody in my DM. I say, "Oh, you have prolactin issues." Now the problem with these people that come to my DM, they are looking for drugs. Give me drugs. Give me drugs. Let me find solution. I want to burn. Right? faithless generation. I don't know about take drugs, so you will need drugs, of course. But I will tell you when you do, right? So, long story short, you don't just interpret high prolactin from a standpoint of say, oh, I've tested and this is what it is. It's not just a single number, right? You have to look at the common causes that elevates it before you can know how to correct it. Then, if you need medication, then you'll be given medication. But with all the hustling, struggle, physical stress and sleeplessness and everything that's going on around the world, you think medication will solve the thing permanently? You will be joking. Anyway, let's talk about the common causes of elevated prolactin, right? Because when you understand the cause, it is very key to correction. And my goal is actually the correction part. And that's going to save you time, energy, and money. Who sent me safe? I'll go sit down, bring the money, let me collect. So common cause number one. Right? And these are the things that is in your hands to correct. Is it not in anybody's hand? The one that is not in your hand, your doctor will help you. Right? So common cause number one. Stress. Ask all those people who have been tested to have hyperprolactinemia, what do you do for a living? Then you find you already know where the problem is coming from. But are they ready to change? No. Every journey begins. And this is one of the most common and overlooked trigger. Every heartbeat stress increase prolactin. This is fertility. And how does it do so? Through the brain signaling pathways. This is life. I'm not going to advise anybody again. Besides that one, some people unfortunately have I don't want to mention big names so that you don't become afraid, right? Some people have a small benign growth in their pituitary gland where the prolactin is produced, right? It does not mean cancer, no, it doesn't. But it would require evaluation, right? So you don't treat prolactin, treat. You have done everything known to human science. They may need to go and check you via CT scan. Let us know whether this is the case. We call it a prolactinoma, small growth in the pituitary gland that can cause it's not cancer, but that can happen and can be a problem. Right? That is the second thing. Second common cause. The first one is stress. The second one is small growth, prolactinoma. Now there are certain medications, certain drugs can raise prolactin. Those of you that are heavy on drugs. Say this brain cell should stop receiving signal. They don't send them. No, the brain is actually doing what it's supposed to do. It is you that is disturbing it. Do you understand? It's you that is disturbing it. If I start mentioning now, a lot of people will not like me, especially women. It's you that is disturbing it. Right? Either you are not sleeping, or either you are stressed out, either you are putting one chemical on your body or the other. It's you that is disturbing it. The brain is always doing what it's supposed to do. And you check, if you stop all these things and change, the problem goes. The problem goes. Is that ebony? Ebony Classic is here. So certain medications, certain drugs can raise prolactin, and that will include, some psychiatric medications, right? Some hormonal medications too can. So, what medication are you on? Right. So it's a holistic study. It's a holistic study. It's not just one thing. And God will bless you for people that are meticulous to help you out. Is that okay? That is the what number? I've given up to how many now? We're talking about stress, small mass, and medication. Yeah. So there's also, remember we talked about thyroid yesterday. Yeah. Thyroid imbalance also can cause high prolactin, especially hypothyroidism, especially that one, right? Low thyroid function can indirectly increase prolactin levels. Yeah, so that is the reason why part of what you'll be tested in hormonal profile, thyroid function is part of it. Is anybody understanding anything, or the grammar too big? Somebody say, this grammar where they blow, how much, right? Every heartbeat tells a story. There are certain things money can buy. There are certain things money can buy. Number one, you cannot give me money for you to go and knock. Just knock. You don't need money. That's one. Number two, you don't need money to sleep. Well, if you don't sleep now, by the time you need it, you have to pay to buy drugs to sleep and to wake up. So you better sleep. Right? As some things money can buy, and they are just in your hands. What are you going to do with your life? Right? So I hope that is clear. You see, why am I even talking about this? Why does this even matter? Why does this prolactin increasing? Why does it even matter in the first place? Because when prolactin is elevated, right, ovulation may not be regular. Timing. So you know what you talk about, time your fertile window and blah blah blah. It become useless, unpredictable. So what's the point of timing when you cannot predict it? Right? Even what do you call that guy? We talked about progesterone the other day. Even progesterone production is affected. Therefore, indirectly, you begin to have issues like implantation issues. So you can see it's a cascade of problems. That's why the things that you can do it. It's not everything that money can buy. Is that okay? It's not everything money can buy. So when you've checked everything, and without checking prolactin, I hope you know fertility can still be delayed. Prolactin issues will delay your fertility. Right? Every heart tells a story. Excuse me. This is fertility. Prolactin is unique. Prolactin is unique. That's why it's a source of concern. Don't just sit down and say, they said I have hyperprolactinemia, therefore you just balance. No, don't do that. Because prolactin is unique. You need it. You need prolactin, but only at the right time. And I told you when prolactin is supposed to rise, when you are breastfeeding. Right? You need only at the right time. When you have high prolactin during breastfeeding, it's normal. So that is when you should have it. But when you have high prolactin, when you are trying to conceive, is abnormal. It's going to be disruptive. It's not its time. Before pregnancy, it's not time for prolactin. Right? It's not time for prolactin. It's time for knacking. Right? Right. Every heartbeat tells a story. This is fertility. Long story short, the goal is just regulation. Is that okay? Thank you for the follow, Desire Monday. Thank you. Is somebody understanding anything? If you don't understand, you will pay for it, and you will pay heavily, and you may not get the result. Right? So you need to understand what I'm talking about. Please understand what I'm talking about. Every journey begins with hope. Right? So every heartbeat the most important part of tonight's gist, this is how it is corrected. How it is corrected. That's the most important part. That's why I started the gist, because I know, unfortunately, the people that I've consulted with, I'm still consulting with them, that needs this information, they're not on the live show. And the problem with consultation is that you don't get this type of education in that session. Right? You don't get educated. They just hit the ground running. You see why we are really concerned about people joining the live stream. All right, let's talk about how it is corrected. That's the good part. Oh boy. This is one of the most important parts of the gist. Every journey begins with hope. But remember, every heartbeat even though prolactin is an issue, it is treatable. Oh, it causes problem with ovulation, but this problem is treatable. So calm down. Let's solve the problem. Is that okay? Let's solve it. Number one. First, you want to confirm that you have elevated prolactin. That is hyperprolactinemia, right? Every heartbeat tells a story. But remember what I said earlier, that prolactin fluctuates, right? So testing is often repeated. You don't just test 2024. Then you hold on to that information and say, they said I have hyperprolactinemia, and this is 2026. No, that would be a wrong way to approach it. Right? But because these people are not listening, they for a very long time. Every heart tells a story. And even when you are testing, it will be done or should be done on controlled conditions. This is life. That is the first thing. So first confirm elevation of prolactin. The second step in the gist is identify the cause. Identify the cause. Every journey begins. Identify the cause. If you're here, please tap on your screen. Every heartbeat tells a story. This is fertility. In fact, I just wish I can just isolate only fan club members to be telling them this thing, because there are many people that don't watch the information, unfortunately. Step 2. Right? Step 2. Identify the cause. of hyperprolactinemia or hyperprolactin? Is it stress related? You know, I told somebody one time, you have hyperprolactin, and with the type of job you do, you person say, no, I'm not going to stop that job. And we're trying to conceive. But because I know I cannot now be bombarding that person's system with drugs. And that's what makes me a bad doctor anyway. Right? That will make me a bad doctor because I already know what the problem is, and I want to stick to that problem. But people, they're looking for drugs. You keep on hearing them saying, "Doctor, what should I take? What should I take?" You take. It's always in your mouth. Identify the cause. Is it stress related? If it's stress related, you already want it. Is it thyroid related? Is it related to medication because of the hormonal treatment you have been having? Is it because of that, or other psychiatric drugs that you may be administered with? Make you say the gay sense. Or is it pituitary related? Each of these things I just mentioned requires different approach. It's not one size fits all. Know what the problem is. Attack it with his own approach. Each of them do. So what is needed? What is needed is not a big thing. It's not a big thing. There are medications that you can take, but I'm not going to tell you because these are not over-the-counter drugs. So that is what you need to do to prescribe and administer. Is that okay? And now these drugs, once they are administered, works by reducing the prolactin production, right? And once the prolactin production reduces, what follows it? There will be a restoring of the normal signals coming from the brain, and the problem is solved. And it's your lifestyle. Not so good, and pregnancy dying, right? It's simple, right? So that's the first. Is that the first one? I said the second is identify the cause. The third is to treat. Then the fourth step, you want to address underlying factors. Why? Factors like you want to correct thyroid imbalance if it is present. You want to reduce chronic stress load. That one is in your hands. What are you waiting for? You want to review medications. If you're under any medication, review it. Right? Do all this and your problems are over. Right? And when you do all this and prolactin returns back to normal, what happens? What do you begin to see? As prolactin comes down, the brain signaling improves. FSH and LH that was confused before normalizes. Follicle will begin to mature properly. And when follicle mature properly, ovulation, regular ovulation resumes, and the problem is solved. Of course, you know that once ovulation is restored, Miss Gold, you're welcome. You know that fertility potential is significantly increased. This is not rocket science. You don't even need the professor to tell you this. Do this and because they born like mad. Oh boy. I'm thinking about you. You've spent so much money for this simple thing. It's because of lack of knowledge. Lack of knowledge. See what ignorance is doing to you. Right. Long story short. Right. Prolactin is a perfect example of something that is small in discussion. People really don't talk much about it. Only when they test that, oh, you have hyperprolactin. Rather, we are interested in ovulation. Right. But it's powerful in its effect. It is. It doesn't damage your ovaries. Your ovaries are not damaged. It doesn't remove your egg. It simply interrupts the signal that allows ovulation to happen. This is it. So if you have an unexplained cycle issue or maybe difficulty in conceiving, you want to pay attention to prolactin. Give it some attention. What's going on with my prolactin? Ask good questions. Has my prolactin been checked properly? Was it repeated to confirm? Don't tell me that you did a test 2007 and they say you had hyperprolactin. That's why you never feel born till today. Something is wrong with you. Something is wrong with you. Ask the question, is there any underlying cause that is driving my problem? Because sometimes the barrier is not even complex. It's just hidden. So prolactin is not an enemy. Right? It's a hormone that is doing its job. Just for some reason it's doing it wrongly. Maybe because of you. Because of the things you are doing. Like stress, not sleeping and stuff. And when you bring it back into balance, the reproductive system often will find its rhythm again. Nothing is hard. Nothing hard. Right? These things are so simple. That's why my heart is not heavy on those people that are young, that are trying to conceive. Because if you just do what you say you should do, you conceive. I'm always thinking about 35 and above. One of these days we'll just go to Zoom. Only those people will take them to Zoom conference. Let's talk. I have some things to talk to those guys. But I'm never ready yet. When I'm ready for you, we'll know what to do. So guys, that is all I have to tell you today.